Namaste, I am Dr. Prafullata Rajput. I am from India and one of the doctors from the Ayurveda platform. In my previous video, I have spoken about general reasons or general issues that can cause painful menstruation or pain during menstruation. Now in this video, I am going to talk about the medical conditions that can be the cause behind your menstrual cramps. If you see my previous video, I have also mentioned some home remedies and things that you could do at home to deal with the pain and make your menses slightly more comfortable. If those remedies don't work, then I think it is the time for you to consult a doctor and understand if there is any medical cause behind your pains during menses. Ayurveda strongly believes that menses are a normal or a physiological part of a human body, of a woman's life. And because it is a physiological part, your periods need to be completely painless, and once your periods are over, you need to feel fresh and light. If that is not happening and the home remedies are not working, then some of the medical conditions that can result in pain. One you must have heard is endometriosis. Endometriosis is a condition in which the lining of your uterus, which bleeds during your periods, it migrates to a different part outside the uterus. So, in such cases, women experience tremendous amount of pain during their periods, and that pain does not subside even after you have lots of painkillers or you do whatever you do, that pain does not subside. So if your pain has been consistently troubling you for over a period of maybe 3 to 4 months or maybe more than that, then it's time for you to check for endometriosis. The other disease which is similar to endometriosis is adenomyosis. In this, you get this tissue that I spoke about, the bleeding tissue that might be present in other portions of your uterine wall or the uterus as such. And that may cause scarring of fallopian tubes, it may cause further complications, and during your periods you will experience a lot of pain. So in these two conditions, your doctor will be able to diagnose and let you know whether you are suffering from these. The other few conditions are PID or pelvic inflammatory disease, where there is inflammation of the organs in your pelvic region. In this case, Ayurvedic doctor could give you or prescribe you natural medicine which can reduce your inflammation, thus reducing your pain. The other cause could be ovarian cysts. A very common cause today. You'll find almost every third woman suffers from either polycystic ovarian disease or which is also known as PCOD or PCOS, or maybe a single cyst as well. In this case, you might also notice that along with pain during your periods, you could have irregular menses, or you could have scanty menstruation where the bleeding is very low or it is for just 1 or 2 days, or you could have excessive menstruation where the bleeding is too much and it might continue for a longer period. In this case, you might also have bleeding in between. So between your menstrual cycle, you might get bleeding. That happens because that cyst in your ovary, it also produces or it affects the hormones that have an effect on your periods. If your periods are associated with pain, plus you also suffer with scanty periods or heavy bleeding or irregular menstruation, then it could be an ovarian cyst. These causes that I have listed down, along with this, if you are a woman who is sexually active, then there is one more thing that can cause pain along with bleeding. So I wouldn't call it menstrual bleeding because the bleeding would be really scanty, but it might happen during the time when your intended menstrual bleeding is. So this could be ectopic pregnancy, wherein the pregnancy happens in parts of your uterus, leaving its original or the physiological part. So there could be a pregnancy in the fallopian tubes, that can then cause pain and a little bit of bleeding when your in your regular cycle. What we have seen in the medical causes is endometriosis, adenomyosis, polycystic ovarian syndrome, PCOS, ovarian cyst, which could be a singular cyst, ectopic pregnancy, which is pregnancy in a part where it is not supposed to be, like a fallopian tube, and the last one is PID, or pelvic inflammatory disease. Now, all these medical conditions, they can be diagnosed by your doctor. We have qualified Ayurvedic doctors on Ayurveda platform who could go through your case history and help you with the diagnosis of your disease. The doctor might require assistance of more tests. So your doctor might ask you to go in for blood tests that test the hormones in your blood, or they might require sonography. And based on all these things, once your diagnosis is made, Ayurvedic doctors can help you in dealing with your disease. If you feel you're suffering from any of these medical conditions, then Ayurveda can certainly help you. It can bring about balance in your body, and it can treat your diseases or the underlying medical cause. So please consult an Ayurvedic doctor on Ayurveda platform. Thank you for watching.